but what I want to do is answer what would be common questions that will kind of explain some of these things as well. So some common questions that I want to answer that really comes up a lot, and that may satisfy any questions you have about obesity surgery. If not, you can email us and we can answer your questions at the end. But first thing that will come up is, how do I stop losing weight? You know, somebody kind of gets the idea that, do you just keep losing weight and keep losing weight until you essentially disappear? And the answer to that is no, because remember, you're eating 3 meals a day, 4 ounces per meal. That amount of food is a normal amount of food to weigh. I just like to use the round number of 150 pounds. It's going to vary for men and for women. They're going to be some lower, some higher, but let's just use 150 pounds. So once you reach that weight, and that's what you're eating, that's what equals what your body is using, and so you maintain that weight. So for example, if someone weighs 400 pounds at the time of surgery, there's a big difference between eating for 150 and weighing 400, 250-pound difference. So there's going to be a big change right away. So the weight loss initially is going to be quite quick, you know, with that kind of a situation, because there's such a big gap. As that person gets down to, let's say, 200 pounds and they're eating for 150, that 50 pounds is not as big a difference. So they're still going to lose it, but that 50 pounds will take a little more time to come off than the first 50. First 50 is going to come off much quicker than the last 50 because there's not as big a difference. So typically with patients, now it's pretty straightforward to, if we consider the band, because as someone loses and loses and loses and they're getting down to where their body, what they're eating and is going to be what they weigh, we would just stop making the band tighter. So that was pretty straightforward. With the bypass and the sleeve, since we're not doing adjustments and making it tighter, typically patients will stop losing their weight 20, 25 pounds above what their goal weight is. And in order to get down to that weight, you just really have to be more strict on what you're eating and add exercise and do that kind of stuff, just like anybody would, even who hasn't had surgery, somebody who's 10 pounds overweight and needs to lose 10 pounds. Because it doesn't take very many calories at that level to maintain 10, 15, 20 pounds. It takes a fair amount of calories to maintain 100 extra pounds or 200 extra pounds, but not 10, 15, 20 extra pounds. So you just got to be, really careful at what you're eating at that level. Next question that comes up is, once you reach your goal weight, then do we take out the band or do we reverse the operation? The answer to that is no, because that is what is allowing you to eat that amount of food to weigh 150 pounds. Remember, we talked about satiety and filling the stomach and sending the signal to the brain. If we were to take the band out or reverse the bypass, you would be back to your big stomach, and that amount of food that you're eating that you're satisfied with at the time after surgery isn't going to satisfy you anymore, because your stomach is not going to be filled up to where that top part is, and so you're not going to have that feeling of fullness, and you're going to tend to eat more. So if we reverse the operations once someone reached their goal weight, the tendency would be to gain the weight back. Now, in saying that, the bypass and the band are reversible operations. The band we can easily reverse by taking it out. The bypass, we have to hook everything back up, but it's rare to have to do that, unless there's a medical reason to, like for example with the band, an erosion may require that. So, but typically operations are considered lifelong, because if we stop them or take them out, you go back to the way you were prior to surgery. Okay, so that covers as far as like the eating and keeping the weight and maintaining it. Some other common questions that come up, and this may vary from program to program, but just some general information. Activity level, we tend to recommend that you not do strenuous activity or exercise for a couple weeks after surgery, just because even though they're small incisions, the muscles, we want them to heal. We don't want you to strain anything. Being active, walking and doing that kind of stuff, we want you to do right away, right, the day of surgery. But going to the gym and lifting weights and that, 2 weeks of not doing anything strenuous. Time off work for most people for the band and the sleeve is about a week on average. We have patients that can have a band on Friday and go to work on Monday, but just kind of plan for a week with the band and the sleeve, and for bypass about 2 weeks.